Welcome. I'm Julie Thompson, the Executive Director of pac-tv, and today we're hosting a COVID-19 update for the town of Kingston. We'll hold these forums every Tuesday and Friday at 10:30 a.m. Watch in Kingston on Comcast Channel 15 and Verizon Channel 42, or watch online on our streaming channel by visiting pac-tv.org/live. To ask questions of the panel during the forum, please email them to kingstoninfo@pactv.org. For forum replays, schedule, and additional Kingston meeting coverage, please visit pactv.org/Kingston. Today's participants will include Dr. Nicole Wood, who is the medical director of the Brigham Health Center in Pembroke, also Paula Rossi-Clapp, who is the director of elder affairs for the town of Kingston, and of course, as always, Josh Warren, who is the chair of the Board of Selectmen in Kingston. Welcome all. Hello, Josh.
Hey, Julie. As always, thank you to you and your team for putting this on. I know you guys have your hands full servicing a number of different communities. Dr. Nicole Wood, thank you for joining us as well today. And Paula, thank you for joining us again. You guys have both been on, so I really appreciate you taking the time to join us again. Just before we get into today's update, I just wanted to give a brief recap of yesterday's letter to residents that went out around supper time. Yesterday evening, the Massachusetts Department of Public Health announced that there were 4,607 confirmed positive cases of COVID-19 in Plymouth County. That number is an increase of 112 from the previous day's total of 4,495. Also yesterday, the town of Kingston was informed of 5 additional confirmed positive cases of COVID-19, bringing our total count to 55. Of those 55, 29 are from one facility. Just one other quick update. Effective, actually, Julie, before we move on, do you mind pulling up those 2 charts? I think that really will help illustrate the increase that we've seen in Plymouth County and the increase that we've seen in Kingston. Now, even with my glasses on, I'm squinting to see that. That looks like that's the Plymouth County chart. Is that correct?
And do you want the other one?
Yes, thank you.
Okay. And here is the Kingston case one.
Now, both of these charts we've been sharing in the daily letters to residents, and it tracks the increase in case numbers day by day, I believe since the 15th of March when the first case was reported by DPH in Plymouth County. So those charts are updated every afternoon. They make their way into the letters to residents. Mm-hmm. And again, just a visual representation of the numbers that we've been reporting for what I believe is now 45 or 46 days. So if you want a good visual representation of the way that things are trending, and hopefully we start to see the jump in numbers day by day decreasing, those are made available every afternoon to residents on the Town of Kingston's website. So just one other quick announcement, and Julie, can you pull up the PDF that I shared?
Yes.
Great, thank you. So effective Friday, April 24th, 2020, the Kingston Board of Health is requiring all persons entering essential businesses to wear a face mask or similar covering to lessen the chance of spreading COVID-19. The image that Julie's sharing now is an announcement from the Board of Health office. Kingston Police and Fire have asked that residents do not call 911 regarding face covering related matters. We've heard stories from cities and towns all across the country where that message was not delivered, and residents inundated their police and fire departments with news of individuals entering stores not wearing masks, things like that. If you do have any concerns related to the recent advisory from the Board of Health, you're advised to contact the Kingston Board of Health. Their number's on that sheet, and their number is 781-585-0503. And for more information on how to wear masks, how to make masks at home using household items or low-cost items, we would like you to visit www.kingstonmask.org, where we've included some information from the CDC. And with that, Paula, I'm just going to jump over to you quick. Can you give us a recap of how things are going at the Council on Aging?
Yes, we are continuing to receive phone calls in and make phone calls out. We're helping people with any basic need and any more intricate questions regarding Medicaid or the different changes that are coming with all the different issues. We're taking care of them in-house, and if it gets to be a little too intricate for us, we're calling on our outreach coordinator, Darlene Regan, and she's handling a lot of the one-on-one support. We continue to get calls for face masks. We're getting homemade face masks donated to the center, and we're passing those along to seniors. So, we're just continuing to do what we've normally been doing, but at a little more of a distance.
Thank you. And one of the things that you guys have had to change recently was you stopped providing rider transportation. And can you just tell us a little bit about what led to that decision and how your team is planning on meeting the needs of seniors who previously relied on the Council on Aging for transportation?
Right. So that decision was not made lightly, and it was discussed with the emergency management team. We did analysis of the risk versus the benefits, and we've been watching the trend go since the beginning of this, since we closed to the public into the building. And we've made adjustments along the way to help people. We've gotten people more onto the Meals on Wheels program for food service, with doctors doing more of the telehealth now. The doctor appointments, transportation has declined. Prescription medication pickups have declined as more people learn to do the delivery service. Stop and Shop, Big Y, CVS, they're all delivering out prescription medications. Grocery shopping, as we know, is now becoming a home delivery service for that, as well as online banking. And the seniors are learning how to, deposit checks online. So we're helping them along that way. And as we started to see the needs for ridership decrease, and as the trend for the COVID was increasing, we thought it best at this time just temporarily to suspend the people transportation as we continue to still provide deliveries to homes. So it's just going to be a temporary thing right now. Hopefully we start to see, like your chart will hopefully indicate, the trend to start going downward, and then we will bring back on more and more services, including delivery and transportation of people.
Thank you. Since you've been on last too, I think the second mailers probably had a chance to really resonate with residents, hit inboxes. What's the response been to the last snail mail mailing that you sent out?
Yeah, that's been fantastic, and another way for us to reach people. We included in that the emergency preparedness form, and we got a great response from that. Since the mailing, we have received 99 to add to our forms list for people that just want to be in the loop for in case of an emergency.
Thank you. And 99 is a great response to that mailing. Certainly well worth the time and energy that you've put into those mailings. One of the other numbers that jumped out yesterday was just how many meals have been served by and delivered by your team at the Council on Aging. Can you just tell us a little bit about what meals have been delivered and what that looks like since closing your doors to the public in March?
Right. So since March 13th, we've been continuing to deliver Meals on Wheels through the Old Colony Elder Services program. Our van drivers took on that task. We aren't using the volunteers, so staff is doing that. So our van drivers and some other staff are helping with that. We're also providing a special home cooked meal that we make out of our kitchen. And since March 13th, the Meals on Wheels plus the special meals that we've provided, we've delivered approximately 1,750 individual trips and meals to people.
That's great. And I believe you also shared that there were 71 meals that were prepared for first responders and essential employees who were working on site. What was that all about?
Last week we did a fun little surprise for the first responders and town employees that are working on site as essential employees. So we surprised them. I took the van, and State Representative Kathy Lenatra, the two of us went and delivered around these meals that were made by our canine officer Michael Lenatra and his helpers. put together this meal, and we just surprised a bunch of people, and made a difference in just their day. So that was fun. That was fun.
I think one of the things that we're all struggling with right now is there's just very little spontaneity in our
Yeah,
lives
right,
and in the
right,
world. So I'm
right.
sure for the folks who didn't expect that,
Yeah.
that little bit of spontaneity, probably, did more than just provide the meal. It probably, really cheered them up during what's, been a pretty gloomy, string of weeks.
They really did. And just the surprise visit, or this, from the phone call to the showing up at the door, and just the little interaction we had, just seemed to make everybody in a good mood.
That's great. And if anybody's watching at home and has not yet contacted you regarding Meals on Wheels or any of the services that you offer, what's the best way for them to sign up or to just get in touch with your staff to learn a little bit more about what you can offer?
Right. So the phone number is 781-585-0511. You can find that out on either the town website. We've sent out multiple mailings to everyone. We're also going to be sending out another mailing of our newsletter that should be going out in the next week or so, with resources and information. So call us. We can connect you with any resource. If you don't have their phone number, we'll get it for you, and we'll get the connection for you.
Thank you. One other program that you mentioned last week that I thought was really interesting, was actually the first time that I had heard of it. You were able to connect some of the COA users to a program that provided them with orthopedic shoes. And even though the Council on Aging was closed, you were able to help direct them through that process. Can you just tell us about that and who may qualify for that program?
So we had a representative that helped out people who are diabetic, to provide them through their insurance company a free pair of orthopedic proper footwear for when you have diabetes, and they receive one free pair of shoes or sneakers a year, plus orthopedic support inserts. And this company would come out once a month and help people to fit them for the shoes. And then annually, they can just continue to get this service. So even while we've been closed to the public, we were still able, through this company, to service another half a dozen people over this time period. And Diane, who's the representative, she continues to support the people that are already registered. So if you're still in need of that service, call the center. We'll connect you with this company.
Great. And I've got one more question for you, Paula, before we head over to Nicole. Is it too soon to start a conversation about a phased reopening, or is that something that's being considered?
We are talking, just like everybody else. I go on a weekly directors meeting with the Massachusetts Councils on Aging. We hear from all the directors in the area towns of the conversations that are being had with their town leaders, the selectmen, the Board of Health. And it's still really up in the air right now. And each town is, as they shut down differently, they're going to reopen differently. And what we're finding is each town is a little bit different, and seniors do cross over those borders. So just because we're the Kingston Council on Aging, we also serviced all the area towns and had 25% of our participants were from area towns. So there's so many questions that need to be answered for opening up, when it finally does become that physical part of it. And we continue to grow with our virtual support and all of that, but it does remain to be seen when we're going to be able to physically open the door and bring people in. So hopefully over the next few weeks, we've got more information to share for you.
Thank you, Paula. And we're going to head over to talk to Dr. Nicole Wood. But before we do that, I just want to remind everybody, if you have questions, please email them to kingstoninfo@pac-tv.org. And Julie will let me know as those come in, and we'll bounce things back over to her in the studio so she can field those questions with our guests. Nicole, thank you again for joining us. This is now your second time with us, and the last time you were on, you talked a lot about telehealth. And I just wanted to thank you. I used telehealth and telemedicine this weekend for a tick bite, and it was very easy. I think I waited in a virtual waiting room for all of 10 minutes. I shared a photo of the tick bite and had a prescription waiting at CVS before long. So it was a very quick process. There was, it was very, very easy to do. The doctor was great. So thank you for telling us about that, because I think that's probably going to be how I seek treatment, for something small like that going forward.
I think you'll find that even after the dust settles with this, that we will find ourselves reaching for that more.
Yeah. And you were mentioning too, just before we got started, and I know it's not exactly COVID related, but it seems like we may be in for a bad season with ticks.
Yes, not that we need something else to worry about, but typically when we've had a winter where we haven't had a cold frost or a cold snap, the ticks don't die off, and they're out. And especially where people are going out more often and hiking and going for nice walks, that's going to be more of a problem. So, I think for people to be aware that ticks are out there, if they have been out in the woods or gardening or whatever, to just check themselves when they come in, but to know that if they find a tick on them, not to panic. There's, as you found, Josh, there's what we call prophylactic or hopefully preventative antibiotic dose that we can do. And Lyme disease, if you were to get it, is very treatable. And you can send us pictures or a video as your rash, and it's something that we can easily treat.
Well, thank you for that. And now some questions related to COVID. So in relation to other parts of the country, how is COVID-19 hitting the Commonwealth of Massachusetts?
Oh, I think we're finding that Massachusetts is hit, not obviously as hard as New York and New Jersey, but it's being hit pretty hard. Um, and I think in the beginning we were probably a little slow to socially distance. But we also, it's a major metropolitan area where people live very closely together, and we're just seeing the ramifications of that. So I think other states that sort of naturally, I joke, I have family in Maine and Vermont, and they've been social distancing for years. So I don't think we'll find the numbers in more remote areas quite as high as Boston, New York. I think the good news, though, is that our peak was not nearly as high as we had all anticipated because of the social distancing. So I think what we are doing, what we have done, is working. These numbers were significantly less than predicted, which is an excellent thing. So we're hopeful that as we are leveling off now, that we will start to see the trend dip down some.
So it's interesting. The numbers in Plymouth County over the last several days have been, or for the last several weeks have been on a pretty steady decline. But we saw an increase last Friday over a 24-hour period of 631 confirmed positive cases. So I get scared because I think, what does this look like with relaxed restrictions? What does this look like with no restrictions? So it's nice to hear you say that social distancing and things like that are working. But with a 631 case increase in Plymouth County overnight, what would that be without these measures? Or is that just the result of an increase in number of tests, increased availability to tests?
I think it's a bunch of things. We did predict that last week and this week were going to be the peaks, and we saw last Thursday in Boston, Friday it sounds like in Kingston, Plymouth, were peaks, and that's not really surprising. I do think, like you said, a huge piece of it is that we are testing more, and so the more you test, the more positive cases you're going to have, just statistically. I think we're also finding that there are hotspots. So, like you had mentioned, in the nursing homes, when we have especially an elderly population that is grouped closely together, it spreads very quickly. And so I think that this would be a lot worse if we weren't social distancing. I think everyone needs to keep in mind that there isn't a cure for this virus. It's not going to go away. The whole point of social distancing wasn't to get the virus to go away. It was to what everyone is known as flatten the curve. And the whole point of flattening the curve is really to lessen the burden on the healthcare system so that we don't have thousands of people all at once needing the ICU, needing a respirator. It was really delaying the spread of the disease, hopefully until we get a vaccine, but really to prolong this so that we don't tax our hospitals, our ERs, our ICUs. So I think that with time, we have flattened the curve. That's great. And as we kind of relax the restrictions, I do think we're going to start to see, another spike, and then it'll probably flatten again. We'll relax a little bit more, another spike. And we were talking about how is summer going to impact it. And I think, the short answer is we don't know. We're hopeful that this virus responds similar to other viruses, where just naturally the UV light is a natural antiviral, antibacterial. Humidity helps prevent the spread just from a molecular level. And just the rising temperatures help to kill the virus. So we're hopeful that this summer it will just naturally spread less, but time will tell.
Thank you. And since you've been on last, one of the big preventative measures that's really taken off has been the use of face masks. I know we talked about it briefly before we went on the air last time you were with us. But with cities and towns all over the country, all over the state, and Kingston very recently adopting a policy from our Board of Health regarding the use of masks or face coverings in essential businesses. Why are face masks important? How effective are they? Is that something that people should be using?
That's a great question. There are some towns now that are actually requiring it even just to leave your home. So when we talked before, it was a little bit more controversial. The point of a face mask isn't to prevent you from getting it, as much as if someone is symptomatic, preventing them from transmitting it to someone else. That said, when our face is covered, we tend to not touch our mouth, our nose as much. It does provide a reminder of not touching your face. So what we have found with this virus is that people for many days can have the disease, can be transmitting the disease, and not have any symptoms. And so they may go out and about and sneeze and touch things. And so if they are infected, having some sort of face covering does help prevent the spread. That said, if you're out and about and you have a face covering on and you touch something and then go to, do one of these, you are going to be less likely to transmit it to yourself. So it really, I think it's a great thing. I know my family has been doing this for weeks now, even before we talked. So I'm happy to see that others are following on board.
Great. And I have a couple of questions on my end from residents. I think Julie may as well. One of them is, should we be disinfecting the things that we bring into our houses, like the mail? I know a lot of us are shopping online more than we have in the past and getting deliveries from USPS and UPS. Groceries, are those things that we really need to be cognizant of disinfecting, washing, and bringing into our homes?
That's a great question. I think the short answer is no. I don't think you have to disinfect and wipe down everything. They have found the virus can live on cardboard for, I believe, 24 hours. But the reality of it would be such a small amount on the product that we haven't, there have been no documented cases of people contracting the illness that way. So I think the short answer is no. I think if you want to be extra cautious when you do have your packages delivered, don't put them on the kitchen counter. Open up the boxes, take out what you need, get rid of the boxes, and wash your hands. In terms of the groceries, I think you put away your produce, your vegetables, all that, and then wash your hands. I think taking some extra precautions isn't a bad idea. But in terms of having to wipe everything down, sterilize everything, I think that's a little that's not necessary.
So if a package is delivered and someone walks by and sneezes directly on it, wipe it down. Otherwise, bring it in, plop it on the floor, open it up, wash your hands.
I think that would be sufficient. Yeah.
Okay. Another question that we had come in from a resident was related to COVID toes. And I'm wondering if you can speak to COVID toes and any other signs and symptoms that you're starting to see come in your building.
Yeah. So, it's not uncommon in really any viral illness for us to see dermatologic related issues. So people have heard of what we call viral xanthoms. So if really any respiratory, any viral illness, we can see rashes and certain skin manifestations of that. So we're just finding that there are other possible viral related manifestations, and one of which is the skin. So the COVID toes that they're talking about are either on the fingers or the toes, and they're a little bit of swelling, can be some little painful bumps. Um, and usually these patients also have the typical COVID symptoms, so sore throat, low grade fevers, cough. It's unusual to have these patients with no other COVID symptoms, but like everything else, we can definitely see it. If you think about hand, foot, and mouth disease, that's a viral infection, and people get rashes on the palms of their feet, soles, palms of their hands, soles of their feet, and inside their mouth. Um, this is just another manifestation of COVID that we're seeing. So people can go online and kind of Google the COVID toes, and they're seeing might be a little purplish, bluish discoloration to the toes. For most patients, they're uncomfortable. Some it can be painful, and they do get these little red dots around that area. It's not a common presentation, but if someone has that along with other respiratory symptoms, I think it's a good idea to go ahead and get tested. We are, or I should say, I've seen it more in the pediatric population, but it can happen with the adults as well.
And you just mentioned if someone's displaying these symptoms, they may want to get tested. Can you just speak to us a little bit about how somebody goes about getting tested? Do they call their PCP? Do they call Mass 211? What's the process if somebody thinks that they may need to be tested?
So I think that, like you said, the first line is call your primary care doctor. There is a list, sort of a checklist we have to go through to see if you would qualify for testing. I will say at Partners right now, it's still a pretty strict uh, testing criteria, only so that we can make sure we're testing um, people who really truly need to be tested, either for their own health and safety or for those around them. Um, so there are many patients who it sounds like it, but they're still not meeting criteria. In that situation, we usually will direct them other places to be tested. I know South Shore Hospital has a testing hotline you can call. I'm happy to provide that phone number if you would like. For first line responders, so police, ambulance, I believe it's nursing home workers as well. There's a place in Foxborough for first responders, they can be tested. But then I know a lot of urgent cares around Health Express, the Minute Clinics, they're also doing various forms of testing. So I would say start with your primary care provider. If you aren't able to get tested through their office, then they will be able to direct you the most appropriate place that you can be.
Thank you. And just a couple more from residents on my end, and then I'll turn it over to Julie. Um, so with many medical treatments and procedures and checkups being postponed, is there concerns within the medical field about how to respond to a flood of patients that will eventually be coming in for a lot of those routine things?
Yes, in fact, what we're very worried about is, heart attacks, um, cancer. These things don't don't care if COVID's around or not. And so what we're very worried about is that Patients have been sitting on worrisome medical problems for weeks and weeks without any care for fear that if they go to the emergency room, they would get COVID. So I think, we need to help spread the message that these places are safe to go. They are taking extreme precautions in preventing the spread within these facilities. So if you are having any urgent medical concerns, do not sit and wait. Call your primary care doctor. If it's an emergency, go to the emergency room. Do not sit at home and wait, because we don't know when this is going to be over. We don't know when bans are going to be lifted and when it is safe to go back out. So don't wait. I'm not worried about the routine things as much. We'll all, I'm sure, add on hours and we'll get the routine issues taken care of. It's more the urgent and potentially life-threatening problems that people are pushing off and waiting on that has most of us more concerned.
Now, this is a follow-up question from the same resident. They have a teenager who's due for the third dose of a vaccine schedule. And with appointments like that being pushed off, they wanted to know, is there any concern with waiting several months for that additional dose or that treatment? Will that void previous doses of a vaccine?
And that's what we're getting a lot of these phone calls. So great question. I think the quick answer is it depends on the age of the individual. For infants, for young children, we're trying to still bring them in and safely provide those vaccines. For the teenagers, the kind of 5, 6 and above, delaying these vaccines by even months is not a big deal. It doesn't mean you're going to have to restart your series. Women in their third trimester of their pregnancy need a Tdap, a pertussis vaccine. We are still providing that for women. So if your child is very young, then I wouldn't delay getting the vaccine. However, if you have a school-age child, then delaying by a few months is not a big deal at all.
Great, thank you. Julie, I'll turn it over to you at this point if you've gotten questions that have come in.
Yes, I do. I have a couple for Dr. Wood. There's a lot out on social media now, especially the last day or two, that local health centers, and Health Express is one that's saying they will do this, are promoting that they have the antibody test, that you can get the antibody test for COVID-19, meaning it will show whether or not you had it, you got over it, and now you're immune to it. That is basically what people think. Can you shine the light on the non-definitive nature that doctors and medical professionals right now have to couch around the whole idea of testing for antibodies?
Yeah, so this whole coronavirus has put the whole medical community really under the spotlight. We are a very conservative group, and we like to study things before we talk and speak in an educated way to our patients, and things are just coming at us rapid fire. The problem with any testing, especially when it's brand new, is we don't know how accurate the testing is. So, for example, the swab testing that most places are doing has about a 30% false negative rate, meaning that if they do the test on you and it comes back negative, there's a 30% chance that test is inaccurate, which is a huge percent. So now when you're talking antibody testing, it's even more confusing because we really don't know what the accuracy of these tests are. So these tests are looking at what our body response is to the virus. And our body responds, I'll simplify it, responds in a couple of different ways, but there are two main antibodies that we typically look for when we are doing antibody testing. There's the early phase antibody testing or antibody response, and then there's a more delayed kind of memory testing that people talk about when they talk about being immune to something. So most people are used to being tested for Lyme disease, and that looks at antibody testing. We know that from the second you're bit by a critter, by the tick, it takes about a month for our antibodies to show up in the bloodstream. And then a year later, we could still be tested positive. So the month for the acute response, a year later, we still might be showing the memory. 2 years later, we might still show the memory. So with a new test, we're not quite sure how long it's going to take before even the acute response antibody, which is called IgM, is detectable. And then we don't know how long until the IgG, the more memory lasting antibody, will take. The other thing is we don't know how long the the IgG will last. And does that mean we're immune? So even if we have the antibodies, does that mean that we can't get it again? We hope so, but we're not positive about that. I need a little graph, and I don't know if you guys if it's going to show up at all. So the IgM is the acute phase. So if this is the time of infection, then this is days, and we're thinking maybe in about 5 to 10 days, our body will be able to see the antibody, the acute phase antibody. And this is the IgG, this is the more memory antibody. So if you're getting tested here, it is very likely that you could have COVID, but still testing for negative as if you don't have it. So again, I think for patients who are calling and saying, I had a flu-like illness in February, was that the flu? Did I have it in February? We're hopeful that the IgG, that long-term antibody, will show us that if they have immunity to it, but we're just not sure yet. And we're going to need a little bit more time to be able to be confident in our answers as to how long do we need to wait after development of symptoms before we get the antibody testing, and how long are the antibodies going to last in our system. And if we have the antibodies, does that mean that we are immune and we cannot get it again?
Okay, that's really excellent information. Thank you so much. So you're basically saying we just don't have enough data based on the amount of time we've been studying this particular virus to be able to make a definitive answer right now as to whether or not antibodies will be built up in our body for just now or for years from now. And we won't know until time has passed. So my follow-up question is, would it harm anyone to be taking this test? And should they, if they get a test that says, yes, you have the antibodies for it, should they feel like they can't get it again? And I think that's what you're warning against.
Right. I think if someone has the symptoms and they're not, to the point where they need to go to the emergency room, my recommendation would be to wait, 5-10 days and then go get tested to see. I think if they have symptoms and the next day they go get tested, there's a good chance they could test negative but still have it. Afterwards, if they test that they are immune to it, I would still take the regular precautions to prevent getting it. I would still wear a mask out in public.
Yeah.
If you find that someone has COVID, I still wouldn't go, to their home or anything like that. For now, we're again hopeful that with time we'll have a little bit more information about this. I will say that if you have tested positive from an antibody standpoint but have recovered, that there are places like South Shore Hospital Partners, they're looking for these patients in terms of plasma donation. So something to think about. Contact your primary care provider if you have tested positive but have recovered, so that they can keep your name on a list in case that need is there.
Okay, so those are the people that knew they had it, they were tested for it, and they recovered from it. That's one group.
Correct.
There's a lot of people, and I think this goes back to just my original question, who back in January, February, maybe even early March, had all flu-like symptoms. And I know in the beginning, we were told that if you had a cough, tightness in your chest, and a fever, those are the 3 telltale signs that you may have it. Just over, I think, the last 24 hours, the CDC released 6 other symptoms that could be possibly part of COVID. So I think there's a lot of people out there that think, oh, I probably had it way back when. I thought it was the flu. I got over it. Gee, I'd like to know if I'm immune to it. And I think in our world where we want everything answered right away because medical science is so fascinating, and why not? We can do anything. That's generally the feeling. And what you said was so true. We just don't have the time-based data yet. Is that correct?
Right. And I think people are forgetting that January, February are flu or the peaks of our flu season.
Yeah.
And this year we saw an astounding number of tested positive flu cases. So, I think it's as the antibody testing becomes more widely available, and you had a flu-like illness and did not go to the doctor, or were at the doctor's and tested negative for the flu, I don't think it's a bad idea to go ahead and get tested. Because it's helping us to understand again the when did this first come to the country, as well as a true number of how many people were infected.
Okay, excellent. I had one other comment, actually, question/comment on the TikTok that we just had with Josh. We had Blake Dinius, who's the epidemiologist for the Plymouth County, and he's a tick specialist on our local scene program, and I interviewed him, and he said what you mirrored, that because of the warm winter we've had, we're going to have a lot more ticks this year. But what I think a lot of people don't know is that right now, especially in early couple weeks of May, the ticks are the size of sesame seeds. They are tiny, tiny, tiny little ticks and almost difficult to see. Do you think we should be putting out a little bit more information for parents who are going to want to send their kids out as soon as it's a beautiful day, play in the grass, play in the yard, that's where they're going to be?
Send your kids out. Send them out, let them play. That's what we should be doing. But check them when they come in, especially if they've been in more, regular grass out in your yard. I'm not as worried about it. But if they've been out in the woods, if they've been on, hiking in trails or, something like that, then I would just do a quick rundown. I think it's like you said, the deer ticks are tiny, 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 tiny. And in my office at work, I actually have a little card with all sorts of different deer ticks as well as dog ticks on them, because baby dog ticks, and I'm not using the fancy terms, can look very much like deer ticks. If you have a tick and you pull it off and you're just not sure, I usually tape it down, put it on a little card, and look at it underneath magnifying glass. The bum of a deer tick is red. That's a quick and easy way to tell. Okay. If you're not sure, then definitely call your doctor. Like I said, worst case scenario, we can always do a prophylactic antibiotic. But what people need to remember is that it has to be a deer tick. It has to be carrying Lyme disease. It has to be biting and engorged for greater than 36 hours in order to transmit Lyme to you. And Lyme is very treatable. So watching for any signs or symptoms of Lyme, even if a month later you develop a rash, we can treat that. So it's not this scary disease, as long as you're listening to your body and you're aware of changes of rashes, joint swelling, that sort of thing.
Okay, great. Thank you. Just a little awareness. Those were all the questions I had, Josh.
Great. Well, I'll turn it over again to Paula or Nicole if they have any parting words for Kingston residents.
I just want to say that you'll see our vans outside Monday through Friday. We're still delivering a lot of meals. So hopefully if you see us, it sparks an interest, give us a call and we can just chat with you or help you out with anything that you need.
Nicole, any parting words?
I would just like to reiterate what I said before, that if you are having any medical concerns, don't wait, call your doctor. What we're worried about is that, in a couple of weeks, months from now, people are going to be coming out of the woodwork with pretty major medical problems that they've been sitting on for weeks and months. So if you are struggling with any issues at all, call your doctor and have a conversation with them.
Thank you. And thank you both again. Just before we wrap up, the Commonwealth stay-at-home advisory and shutdown of all non-essential businesses is currently in effect until May 4th. Governor Baker made it clear last week that the decision to lift and relax restrictions would be dependent on the data and not a date that was previously circled on the calendar. Again, last week, we saw over 1,600 new cases of COVID-19 in Plymouth County. We saw an increase of 20 in Kingston. But I just want to urge residents not to lose hope and to please be patient. As Dr. Wood said, social distancing is working. Things look better than they did when folks sat down to look at what the potential impact would be weeks ago. So please continue to maintain social distancing. Please continue to limit exposure to others. Continue to avoid crowded places. Continue to wash your hands vigilantly. And with the Board of Health's recent vote, please, please, please cover your face when you're going into essential businesses in Kingston. And I just want to thank everybody for helping keep Kingston safe and healthy during this ongoing public health emergency.
Thank you, Josh. Thank you again for always bringing us some terrific guests. Thank you so much, Dr. Wood, and thank you, Paula. Love to have you on, and I'm sure we'll have you on again. This is Julie Thompson from pac-tv. We will see you every Tuesday and Friday at 10:30 for your Kingston COVID-19 update. Please stay safe. We'll see you soon.